The views and opinions expressed on this program do not necessarily reflect or represent the views and opinions of 580 WCHS or West Virginia Radio Corporation.
And a very pleasant good morning to you. You're listening to Ask the Expert, WCHS, the voice of Charleston. I'm Dale Cooper. Thank you so much for tuning in on this Wednesday morning. Yes, it's a Wednesday morning, and we have in studio with us this morning, welcoming back into the studio. Been looking forward to this show because it seems like we left a lot of unfinished business last time. Joining me in studio is Dr. Adina Bowe and Dr. Hani Nahza. They are from the Behavioral Medicine and Psychiatry for WVU Physicians of Charleston. Dr. Bowe, good morning. How are you doing this morning?
Good morning, Dale. I'm fine.
I guess I need to give you your microphone. I forgot to put it over near you. And Dr. Nahza, good morning. How are you this morning?
Morning, Dale.
Thank you guys so much for coming back in. Of course, a couple of weeks ago we had a show, and we were talking about, of course, different addictions and treatments of the addictions, and that's what you guys do as a living. You specialize in treating addictions, both pointing the direction for psychiatric help, for medicine help. One thing I wanted to just mention, and you dropped this right before we went on the air, so I didn't have a chance to ask a bunch of follow-ups. But tell me a little bit about your residency program for this. You were explaining to me it's the oldest in the country for this type of medicine.
Oh yeah. So actually, we have with WVU Charleston here and Charleston Area Medical Center, we have lots of residencies. We train residents to be physicians in the area and everywhere in the world, actually. And one of the programs that we have in CMC is Internal Medicine and Psychiatry Combined Residency Program. And this program has been up and running for years now, and we are the oldest internal medicine psychiatry or the oldest continuously operating internal medicine psychiatry residency program in the country and probably in the world, because there's no such combined programs anywhere else. And I just want to mention that the whole thought about internal medicine and psychiatry combined residency is actually to have a holistic approach to patients' care. So pretty much we take care of their medical problem, psychiatric problem, certainly addiction, because addiction is pretty much in both specialties and from both specialties. So we make sure that the body and the mind, both of them are good. And that's actually our message to the world. And we've been serving West Virginia and the whole country and actually the whole world, because some of our graduates are from international medical school, and some of them went back to their countries, and they have very good message to share with other people. So it's healthy body, healthy mind that will make healthy life.
That's really fantastic. And when you think about, when we talk about the practicing medicine and things along those lines, we talk about, the best practices and the things to put into place. And when you think about that, you're really kind of the beginning point of that here. Mm-hmm. That means that you really have access to a lot of information, continuing education, and you get a lot of folks that bring new blood and new mm-hmm. ideas into the area. So, I mean, that's really fantastic. Of something to have just here in our own little backyard here in Charleston, West Virginia. That's a great thing to have.
Exactly. And we have lots of resident that comes from very like from other countries. We have residents that come from very far away states to be trained here in Charleston, West Virginia. This is a big honor for us, and this is a good thing that we are sending our message to the world, how to treat patients with internal medicine and psychiatric disorders as well as addiction. And this is actually how we started this CODE program, which is a comprehensive opioid addiction treatment center that Dr. Bowe is the medical director of now, is actually from the internal medicine and psychiatry program. And both of us, me and Dr. Bowe, we work with the residency program. We train residents, and we also have medical students from WVU. We are actually one of the campuses of WVU, and we get medical students. We also we train lots of medical students from other osteopathic schools and allopathic schools. So we actually I think we do a pretty good job in this holistic approach to patients' need. And that's something we do with patients with addiction. When they come to us, we actually try to provide them with a holistic care. We do psychiatric care, we do medical care, and of course we do addiction care.
And that's what we're going to get into some this morning. And really, that's a great little kind of an essay on the area, a little background here, because I didn't know any of that. And so it's nice just to know that we have that right here in West Virginia, and that we have this kind of professional outlook and really influencing worldwide medicine when it comes to this. I mean, that's really pretty spectacular.
Exactly. And we have lots of faculty members who are trained in internal medicine and psychiatry that are part of our faculty. And I can tell, I think we have more internal medicine and psychiatry faculty among all other med psych programs. We actually have 4. And one of us is actually the chairman of psychiatry, which is Dr. Griffith, Dr. Bowe, and I, and also we have Dr. Hamzi. So we have big faculty, and we have I think 8 residents now. Hopefully we'll have like 10 next year. And we are we are actually the oldest continuously operating med psych program in the whole country.
That's really fantastic. That's Dr. Hani Nahza. Also with us is Dr. Adina Bowe. We're going to be talking about addiction and addiction treatment and many of the other things that surround it. We have a whole plethora of things that we can get to this morning. The behavioral medicine and psychiatry can be found over in Canal City at the CAMC building. The phone number is 304-388-1000. That's 304-388-1000. The web address is wvupc.org. That's wvupc.org. We have a ton of stuff that we can talk about this morning, and one of the things that's near and dear to my heart, since I have a newborn, is, and we touched on this just for a minute during the last program, and that's addiction during pregnancy. And that could be any number of addiction, and it seems like anymore whenever we talk about addiction in West Virginia, everybody leads with opioids, because it's in the news, it's the opioid scare is the big thing. But we still have to look at things like alcohol and cigarettes and things like that, especially when it comes to pregnancy. And I know probably the answer to this just innately, but in West Virginia, is cigarette and alcohol addiction during pregnancy something that's a significant problem for us?
Oh, definitely. I think our estimates are pretty high compared to other parts of the country. We're up to about 20% with our pregnant ladies when it comes to cigarettes, smoking. In terms of alcohol, we're anywhere between 8 and 10%, and whereas opioids are about 5% for our pregnant ladies. That's
just, it's very sad. For just a moment, maybe you could kind of recap some of the let's take smoking first. Some of the symptoms that the mother and the baby would suffer from a mother that continues to smoke during pregnancy. What's some of the things that generally leads to for the infant?
Okay, so when it comes to cigarette smoking, we know that it elevates the risk of preterm labor. Also, you have infants who are born underweight because of smoking. In terms of maternal fetal bonding, that's usually not impaired. But it's just more so the risk about weight size. Yeah.
And does that lead to problems later on in life? Could that lead to different issues from that baby as it's growing up and everything? The having been exposed to smoking during the pregnancy, does that lead to any complications later on?
So far, people have not thought so in terms of cognitive decline, but what they do recognize that women who smoke are more likely to have kids who smoke. I think there was a big European study that showed that mothers who smoke have children who tend to have higher smoking rates than other kids, and they think it's something to do with just the metabolites of smoking.
Yeah, that makes a lot of sense. And transitioning over to alcoholism then. So parents that, or in this case, unfortunately, we're talking about mothers, but mothers that drink during pregnancy, what are some of the symptoms that a baby's going to have if that happens?
Okay, so I think we're all familiar, a lot of us are familiar with fetal alcohol syndrome. You have babies who are born with smaller brains. They sometimes have dysmorphic features, such as small lips. We call it a micrognathia, a small philtrum. And they also have cognitive decline when compared to other kids. That's very noticeable, actually.
Wow, so cognitive decline as well. I mean, these are all major, significant things when you're thinking about taking the responsibility of the child that you have. I mean, and like what we said last time, if it was easy to quit, the chances are that these mothers would quit are probably nearly 100%. If they could just walk away from it to protect their child, I'm sure they probably would.
They absolutely would.
But being in the grips of the addiction in some way, shape, or form just keeps them from being able to do that. I saved opioids to last just because I saw a documentary not that long ago that was talking about some of the devices that have to be used for babies that were born for mothers who are addicted to opioid, and like some of these, what they call it, like bridge devices or something like that. To think about the withdrawal symptoms that those babies are going through after they're born, I mean, it really upsets me. I mean, it's very, very sad, but being born addicted is just one of the symptoms that a baby's going to have if it's born of a mother that's been on opioids, right? What else can you expect?
So in terms of a neonatal abstinence syndrome, you have babies who are addicted to the drugs. You also have them, they're more irritable. They tend to have, we call it a poor suck in terms of not latching onto the nipple. Some of them have difficulties with cold and heat intolerance. And actually, a lot of them have to spend many days in the neonatal intensive care just recovering. And so we always encourage women who are addicted to opioids to stay on medication-assisted therapy in terms of buprenorphine as well as methadone.
So you can manage your addiction if it's a demon that you're battling. You can try to manage your addiction while you're pregnant, and these drugs that help with your addiction are not dangerous to the baby, or at least not to the level that being on the opioid would be.
That's right. It's much more dangerous for your baby if you are addicted to, for example, heroin or pills and not getting help, as opposed to being on Suboxone or methadone.
Oh my goodness.
Yeah, that's part of what we call harm reduction, Dale.
Mm-hmm.
So pretty much we all know that addiction is bad. It's horrible, actually. And when we talk, and actually I learned that the hard way the last 3-4 years. When we talk about addiction, we don't wear the patient with drug addiction shoes. So we don't know how they feel.
Right.
We don't know what they have. And, after a while in addiction, their brain is different. They have lots of changes. They lost lots of abilities to control themselves and their impulses. So even buprenorphine, methadone, the newborn is going to go through withdrawal. Now, of course, with buprenorphine, methadone, we're talking about probably like 1/3, right, Dr. Bowe?
Yeah.
Roughly like 1/3 of babies will go to the neonatal abstinence syndrome. So this is much better than going into withdrawal from heroin.
Right.
It is much better than going into withdrawal from from fentanyl or other these heavy drugs. So this is exactly the harm reduction. We are reducing harm. We don't want 70% to go into withdrawal. We want only 30%, and this is a little more manageable from pediatric standpoint. Like they can manage neonatal abstinence syndrome with buprenorphine or methadone much better than the other ones. So also there is lots of other things. There's lots of abstinence treatment during pregnancy that is a little debatable because some people will do fine, but most people just don't do well because of the addiction as an illness is going to cause more relapses during pregnancy with the abstinence treatment. But that's another option that the patient can choose. So actually, not everyone is the same, and people can choose different routes during pregnancy. The other cofactor here is mental illness. Lots of patients with drug addiction problems, they have comorbid psychiatric illness and medical problems, of course, and that will complicate things. And treatment of all these things in the same time, plus counseling, may be very good for the mother and the baby in the future.
And I think that you bring up an important point there, and it goes back to what you said right at the top of the show, talk about a holistic approach. A lot of times, when you start talking about, addiction is one battle that you have to fight, but you also have to battle the forces that lead to that addiction. And, nobody just unless you're one of these babies, but generally speaking, you don't just wake up addicted one day. Something led you down that path. Maybe it was just something you did when you were in your youth and it was wild recreational. You got hooked to it, and that's the long and short of it, and you need to battle that. But maybe it's environmental. Maybe it's a family full of abuse. Maybe you were abused in some way as a child, and you found drugs as a way of escape of some form. You have to get to kind of the reason that you allowed yourself to get open to addiction first before you could even battle the addiction, or else maybe you get somebody somewhat weaned off the drug and get help, but then if they're still in that environment that leads them back to the drugs each time, you're not going to really make any progress. So you have to have, when you talk about that chain of treatment or that holistic approach, you have to have that. Or I mean, if any part of it fails, then you're going to deal with a relapse, or you're going to deal with a failure, I'm assuming.
Yeah, that's right. And it's very important to know that 40 to 60% of people with addiction problems is genetic, right? So there's a part of you that you can't change your genes, right? So, because not everyone who tries meth or tries opioids get addicted. There's the people who have the genes for it and who have the environment that supports that addiction. And it's pretty sad because most people cannot change their environment. So you can go into a program for 30 days or for a year, but you're coming back to that same environment, those same social pressures. So that's why a treatment for addiction is a chronic model. You're in lifelong treatment because you have a lifelong problem.
If you're listening out here, this is Doctors Adina, Bowe, and Hani Nahza is with us this morning. We're talking about treatment of various types of addiction. We're talking about drugs and addicted during pregnancy now. We're going to run the gamut. We're going to talk about eating disorders and all types of different things this morning. If any of this stuff pulls on your heartstrings a little bit, if you want to call in, I know that this is kind of a touchy situation. You're more than welcome to use an alias if you want to. I say Jane or John is fine. You don't have to give specific information if you're calling in on the radio. If you're not comfortable with calling on the radio, the number to contact someone's 304-388-1000. That's 304-388-1000. More information at WVUPC.org. That's WVUPC.org for the Behavioral Medicine and Psychiatry Department, which is located over in Canal City. But if you want to call us this morning, our number is 304-345-5858, 304-345-5858. And we can talk about any of these things, whether it be addiction during pregnancy, about eating disorders. We're going to talk about many other things this morning. I wanted to kind of tease before we go to the break. We're going to talk a little bit about the myths of addiction when we come back. And just as kind of a quick summary, as far as the myths of addiction goes, do you find that folks that are misinformed or badly educated on addiction and what it means, is that another hurdle that you have to overcome with treatment, not only for the person but maybe their family and things along those lines? This whatever it is that they think they understand isn't always necessarily true.
That's absolutely correct. And it not only extends to family members, it's even the patient themselves and as well as treating providers.
Yeah. I understand that could be a pretty big issue. So let's talk about that when we come back. Let's go ahead and take a break. We'll be back in just a few moments. You're listening to Ask the Expert on WCHS, the voice of Charleston. I'm Dale Cooper. And you can give us a call this morning. Our number is 304-345-5858. That's 304-345-5858. You're listening to Ask the Expert on 580 WCHS, the voice of Charleston.
Hey, it's Wolf Bowers and Chris Lawrence inviting you to join us Saturday, June 8th from 10 till noon at Coonskin Park Lake for our third annual Take a Kid Fishing Day.
It's a day of free fishing, Saturday, June 8th. Wolf and I can't wait to fish with you and your family. Bring the kids, bring the fishing gear, and get ready to have a lot of fun.
Special thanks to Spring Hill Rod and Gun, Chick-fil-A, Cataroo's, and Southern Eye Care.
I was just wishing I could go fishing forever.
There's one. There's a fish right there.
Well, I'm sitting here wishing I could go fishing forever. Let's go.
We can't wait to fish with you and your family Saturday, June 8th from 10 a.m. till noon on the lake at Coonskin Park. Thank you, Spring Hill Rod and Gun, Chick-fil-A, Cataroo's, and Southern Eye Care. Don't miss the third annual Take a Kid Fishing Day Saturday morning, June 8th with Wolf Bowers, Chris Lawrence, 96.1 KWS, and 580 WCHS.
Well, I'm sitting here wishing I could go fishing forever.
Good morning. An accident on I-64 on the Oakwood Bridge has cleared, but major traffic congestion remains, both due to the accident and the work happening at the I-64-77 and I-77-79 splits. Expect continued delays this morning and reduce your speed approaching these areas. Traffic brought to you by City National Bank with 87 convenient locations to serve your banking needs. City National Bank, equal housing lender. For a convenient location near you, log on to bank@city.com. I'm Jeannie Kay from the WCHS Radio Network Traffic Studio.
You're listening to Ask the Expert, WCHS, the voice of Charleston. I'm Dale Cooper. Thank you so much for tuning in on this beautiful Wednesday morning. It's going to be a lot hotter today than it was yesterday. Temperatures getting close to 90 degrees, so that 75-degree weather with no humidity. Hope you enjoyed it yesterday. So we're going to see a true summer-like day today. Joining me in studio today, we're having a fantastic discussion. Not necessarily the happiest discussion in a lot of areas because of what we're talking about that folks have to wrestle with, but it is nice to know that there are outlets to get help. We're talking about different types of addictions and treatments of that this morning, courtesy of WVU Physicians of Charleston, the Behavioral Medicine and Psychiatry Department over at the CAMC building in Canal City. The phone number is 304-388-1000, 304-388-1000. On the web, it's WVUPC.org, WVUPC.org. You can call us this morning at 304-345-5858, 345-5858. If you've listened to a portion of this program and you want to listen to the whole thing, we will be up on podcast as well, WCHSnetwork.com/podcast. We'll take you over to our podcast page, and you about an hour or so after the show is over this morning, you'll be able to go and listen to the entire thing. Right before the break, we did tease that we wanted to talk a little bit about the myths of addiction. We're also going to talk about getting treatment from special populations and eating disorders, all in this second part of the program. But let's circle back to the myths of addiction first, because I think that it's important to dispel some of these things, because you hear all kinds of wild things. I mean, just in casual conversation sometimes, and from doing this show, I don't know a lot, but I learn a lot that I retain a very little bit of from doing the expert show. It's kind of like that old commercial about being in the hotel. You stay in the hotel overnight and suddenly you're an expert. But the one thing that I have picked up when you're standing in line at the pharmacy or you're at a restaurant and you hear crosstalk at a table next to you that you just can't help but to overhear, a lot of the information that people have about some things are just wrong. And you know it's wrong. You're like, oh my goodness, I wish I knew that person so I could interject, because I'm not an expert, but I know people that are, and I've addressed this particularly. So talking about the myths of addiction, what are some of the most heinous? What are the things that you run into a lot that you have to overcome as far as myths go?
Okay, I think one of the ones that's more prevalent now is with regard to the use of marijuana. I think a lot of people are now believing that it's totally benign because it's regulated and it's okay to use in certain states. And what a lot of people don't realize is that the THC content in it has dramatically increased from maybe just even 5-10 years ago. And so a lot of the studies that were done on marijuana had to deal with a THC content about 5-6%. And now manufacturers are making a THC content about 25 to 30%, which is super duper high. Yeah. So marijuana is not a safe drug. You know, what people think. I
mean, it's a drug. It's like, you might be able to use it in moderation, like alcohol or something else. And I mean, if that's what you choose to do in a legal capacity, that's fine. But you can't just say because it's an herb and of the earth that it's going to be completely benign.
That's right.
That's not necessarily true. There might be, whatever side effects or whatever long-term goes may not be as bad as alcoholism or something, but that doesn't mean that you don't. And people say, well, you can't get addicted to it. Well, we talked a little bit between addiction and dependency and things along those lines the last time we were here. I don't think the science necessarily backs that up. You can at least become dependent on it, if not addicted to it, right?
Yeah, and there's lots of other factors here. Marijuana, alcohol, even in moderation, can increase risk for mental illness. Can increase risk of other medical problems. So actually, I'm not saying abstinence. I'm saying the responsible drinking, for example, is very important. If someone has genes of addiction and he knows or she knows that they get addicted pretty easily to things, they should stay away from that. So it doesn't matter if it's legal or not.
Right.
It matters that it is a psychoactive substance that can cause psychiatric and medical problems. So populations who are in danger for addiction, medical problems, lots of other things, they should stay away from that.
Yeah, I find too, and I don't want to get too far down the rabbit hole on medical marijuana or marijuana in general, but I find too that advocates for marijuana, and look, I have no, I think that it regulated safely, whatever. But when you start talking about it medically, and I was in Michigan when Michigan rolled out their medical program, and the one thing that I noticed is a lot of people without real sound science behind it, suddenly marijuana became a cure-all for any number of things. Oh, you're suffering from social anxiety. Take some marijuana. You're having some back pain. Take some marijuana. It's like all of these different things that, I know there's some science but there's not a lot on what it actually does help with. And there might be some areas there where it's manageable. Obviously, we're trying to get legal medical marijuana in this state up and running, but you just have to be a little cautious because it is a drug still that you're taking, and you have to make fact-based decisions because not necessarily is it going to be a magic bullet for everything that ails you.
That's right. I think it's important to realize that when opioids came on the scene, they were considered completely safe. They thought all the regulations were fine.
Great point.
And yet we had at our American Psychiatric Association, we had the people who passed the law saying that it's safe, turn around and apologize and said, well, we didn't really do all our studies and now we have this big crisis in our hands. So I just want to tell people, just be a little careful.
What's another myth of addiction?
That alcohol addiction is much easier to control than anything else, than the other addictions. It's not a real addiction.
Oh yeah, because it's so common, right?
It's so common, and it's legal.
It can't be that bad, right? But I've known people who suffered from alcoholism, and in fact, I knew somebody who had two different addictions at the same time. They were addicted to alcohol and they were addicted to cocaine. And I think we talked briefly about her the last time we were on the program. But the alcoholism was by far the hardest for her to kick. There was like a controlled environment and a process to get her off of the cocaine that really helped. The last that I knew, she was still going to step programs years after she was clean and sober, which you're supposed to do. There's nothing wrong with that. But still, you're in these programs forever. She's not only going to alcoholics, but also the narcotics, going to all these different programs to try to get help. But she would tell you probably to this day, I mean, I haven't talked to her in a long time, that alcoholism was the hardest demon for her to battle. And so there's people out there that think, dad might have this problem with his alcohol, or granddad or mom or whoever it might be, but it's just a matter of time. He can kick that whenever he wants to. He can control it. I mean, you can get it at the convenience store. It can't be that bad.
Well, that's the problem, actually, that you can get at the convenience store.
Right.
So people with alcohol problems, they go to do grocery shopping, to pick up the prescriptions. They go to like dinners. They go anywhere there's alcohol. And another thing, alcohol withdrawal can actually cause deadly outcomes, can have deadly outcomes. People can go into seizures, they can stop breathing. So alcohol withdrawal is deadly. It's actually much worse than opioid withdrawal. Opioid withdrawal is very uncomfortable, but doesn't kill people. Alcohol and benzodiazepine withdrawal can actually kill people. So alcohol addiction is horrible, very hard to treat, and very hard to control, actually. Because the control environment is very hard to find, actually.
Yes, alcohol everywhere.
If you're seeking help, and if any of this is kind of ringing familiar to you, 304-388-1000, 304-388-1000. That's the first phone call that you can make, and that will get you to the Behavioral Medicine and Psychiatry Department for WVU Physicians of Charleston. Do you have another myth, or do you want to move on to our next topic?
Okay, heroin is just a ghetto drug.
Gotcha.
Only people in certain areas use heroin.
Yeah. Let me just interject real quick here. This weekend, I witnessed a heroin deal go down that I took a picture of and forwarded to the police department. But the person involved in purchasing, you would not imagine in a million years would have been somebody that was purchasing the drug. I was shocked it was happening right in front of my face, and I was like, "Are you kidding me?" And it was bold and out in the open. And I said, "Okay, well, if you're going to be that bold, I'm just going to go ahead and take your picture and send it on to the police department." So. Sorry if you got arrested out there, but not. But really, that is true. I mean, and for one thing, it's kind of from a socioeconomic standpoint, it's kind of sad that somebody would shrug and say, "Oh, it's just a ghetto problem. It's just a poor people problem." Well, just a poor people problem. I mean, that's still a problem that needs to be addressed. But then you have the co-writing fact on that it's not true. I mean, it's a problem that anybody, and especially in this state where we hear this narrative so often. I started off on opioids. I no longer could get my prescription for it because my broken leg or whatever got better, and so I needed to find a fix somewhere. I mean, heroin is what people turn to generally, or a lot of times with that, and that could be anybody, anywhere on the socioeconomic spectrum. That could be you. So you really need to not necessarily. We shouldn't shrug things off just because they only affect the ghetto or poor people anyway. But that's just simply not the case with heroin, right?
Yeah. That's right.
Very good stuff. Let's go ahead and move on. I want to make sure we hit on some more topics this morning. And one of the things that Dr. Bowe brought up to me, and I think it's very important, in the Charleston area might be one of the few places in this state where this really would resonate with some folks. But when you talk about special populations, you're talking about gay, lesbian, trans communities, things along those lines. Mm-hmm. We're not San Francisco here, obviously. We're not New York. We're not somewhere that's going to have a robust population of this special population, but in a way that makes it more difficult for the folks that we do have here, because ostracization is a real thing.
Oh yeah, there's so much marginalization, and what we've been finding is that the rates of addiction is higher in these populations. They're pushed away from their families. There are very few support groups around, and it can be devastating.
I mean, imagine yourself if you're somebody that if you're in an area where you know that 8 out of 10 people around you disagree with your lifestyle, whatever it is, and you feel that you live your life the way that you are meant to live it, and you're happy in the way that you are, but you can't talk to people about it, and then you're suffering from an addiction or some problem along those lines, you may feel like you have nowhere to go at all, that there's no help for you. But you're here to say that that's not true, at least from your perspective. You have the ability to help special communities and special population. And in fact, I take it to mean that you maybe not specialize in, but you're ultra aware. You have a process in place for these folks.
That's right. And even within our department, there's an outreach to adolescents who have sexual orientation or gender identity issues. We've started a research project, and we just want to reach out those individuals and help. You can just call our department and find out more about the program and figure out how you can get some help.
Let me, before we move on, let's take a phone call here real quick. Francis has called in from Charleston, has a question for the doctors this morning. Francis, good morning. How you doing?
Hello?
Hi, Francis. How are you?
I'm all right.
What's your question for the doctors this morning?
Well, my granddaughter's been in Highland. This probably makes her third or fourth time. And they just set her out and she don't get no help. Now she's back in Highland again. And this time she's truly wanting help, but she can't find nobody to help her.
Well, you can always send her our way, Francis.
We'll be happy to help her.
Yeah, sure.
Well, I don't even know about you. I don't know where you're at or where.
Yeah, we are part of WVU, West Virginia University, the Charleston campus, and we are located at CMC Memorial Hospital, the vascular building.
Well, why didn't they send her there?
Yeah, well, we're there. We've been there for a long time, and we'll be happy to see her and help her out. I'm glad that she is seeking help. That's a good thing. That's a really good thing, and she is trying real hard, and seems like you're very concerned. So.
Well, I am. It took us 8 hours to get her back in Highland this time.
Yeah.
It's just been such a problem. I'm not on the air, am I?
Yeah.
You are, Francis, but let me give you a phone number. It's 388-1000. 388-1000 is the number that you can call, and that can get you your first step to finding out the information. They're located just over in Canal City at the CAMC building, localized to Charleston, so easy to get to, and help's just a phone call away. If you give them a call, 304-388-1000, 388-1000, be more than glad to try to help out your granddaughter.
Well, I appreciate it.
Keep up the good work, okay?
Thank you.
Thank you, Francis.
You too.
Bye.
Bye.
Wow, yeah, that's but that's what you're here for, right? I mean, that's the type of you don't like to hear those phone calls where somebody is out there trying to get help, and maybe they've taken one path many times that they keep on getting blocked at it. There's nothing wrong with seeking out a different path, seeking out different treatment options, and for folks that specialize in it, not a bad thing at all. Just briefly though about marginalized communities, special populations. Again, one phone call, you can call the same number, and would you encourage for these folks to be forward with exactly the problems that they're trying to overcome? You know, this is why I'm seeking help. I'm hesitant because I might be gay, bi, trans, whatever it might be. Can you point me in the right direction? And the folks will kind of know how to point them, how to get them into the program.
Sure, but not everyone feels comfortable saying those things over the phone. So just call and say you want to get help and you're interested.
That's all you need.
Yeah, that's all.
So that's all you need to do. The number once again is 388-1000, 388-1000. Running out of time, just about 5 minutes left in the program this morning. I want to make sure that we get to eating disorders before we move on too, because yet that's something else that affects folks. When we talk about eating disorders, what are the more common ones that we see in this area?
Okay, so we see a lot of anorexia nervosa. That's where people would restrict the amount of calories they take in a day. For example, you and I would probably eat like 1,500 to 2,000 calories. People with anorexia might restrict down to maybe 500 calories a day. They also have a lot of excessive exercise because if you eat, you want to kind of burn those calories. So people who suffer from that disorder would have excessive exercise. Well, they would like maybe run 3 miles a day and then go to the gym and then do another 2-hour workout.
So somebody you might otherwise say, oh, look how healthy they are.
Yeah.
Not necessarily the case.
No. And in fact, if you were to go to a lot of gyms and just look, you can just look at people based on their body mass index, look at their facial features, look at that like we call it a temporal muscle wasting and buccal fat pad wasting. You can see people with these issues. Another type of eating disorder is something called binge eating disorder, where people have compulsive eating. They cannot control their appetite.
What is the definition of that? Because I mean, sometimes I'm like, man, I just can't stop eating this pizza right now. I mean, that looks so good, but I don't think I have an eating disorder. I mean,
that's normal.
but so when somebody is trying to kind of self-evaluate, like with something like binge eating, how would they know if maybe that they actually have a problem?
Okay, that they cannot control their behavior and it overtakes them. So it's not just sitting down and maybe finishing off a carton of ice cream. It's getting up, eating food much more than you need, not being able to tell when you're full, and distressing you. You know it's a problem. You want to stop, but you can't help it. Okay. Which makes it the disorder. It creates a lot of anxiety, and a lot of people have a lot of depression around it.
And folks will, I mean, obviously, if this is something that you're battling through, don't think that just because it's only food or it's not a drug or something like that, it doesn't mean that you don't need help. You do need help. I mean, and because this could have lifelong health effects for you. What other, circling back when we talked about the first one we talked about with anorexia, same question. I meant to ask that follow-up. For example, I lost a lot of weight almost 2 years ago now. And I did calorie restriction and worked out, but my calorie restriction started at like 1,380 calories. And then I modified that depending on what I was doing and what I was eating and things along those. So I don't think that was overly extreme, but there are folks out there that, like, if you were budgeting yourself at 1,000 calories and then you were forcing yourself to burn 500 calories a day or something along those lines, is that like it's getting too close? Like you're almost expending more energy than you're taking in overall, and that's not healthy.
Right, and the problem with this disease is that you don't know you have the problem, and most people who suffer from it have had issues with it for a long time. So people kind of see you as thin and they see it as a good thing, right? But problems with the anorexia, if you're a woman, you might stop having your period, you might lose hair, you're cold all the time, you have numbness and tingling in your body. All right. You might also find yourself abusing laxatives or diuretics just to lose that extra weight.
Oh man, these are all problems that I've known folks that have had to deal with at different times, and they're things that could be destructive to your health. Again, the phone number, if you suffer from these problems or have a loved one that does, you can get a hold of the WVU Physicians of Charleston, the Behavioral Medicine and Psychiatry Department. It is located over in Canal City at the CMC building. 304-388-1000, 304-388-1000 is a number that you can call to get through and get on your journey to start help. Only about a minute left in the program, so I want to go ahead and kind of wrap up what we've talked about. It's been a great discussion. I really appreciate Dr. Nahza, Dr. Bowe, both of your input on these problems that we've been dealing with. A lot of these things go nationwide. They're problems on different levels. Some of them are specific to our own backyard, like the opioid issue. Obvious, we're near ground zero as far as that goes. But I think the information we've shared over the past couple of weeks, if folks have listened to this program, they know there's hope. They know that there's help out there, and hopefully now they know the path. The phone number, really, it's just a phone number that you can dial to get on that journey. Do you have any final encouraging words for someone just in the last few seconds for someone that might be battling from this, or a family member that's trying to steer a loved one?
Yeah, so actually doing this job for 3 years now, it is the most rewarding job I've ever done in my life. And I got my reward from my patients. And when I see patients who are sober for more than a year or a year and a half, or I have some people for 3 years, that makes me feel there is hope. So I don't care about books. I don't care about number. I care about human being. Humans are the one responsible for change, and they will change. Change may happen and will happen. And there is some help out there, and it's going to happen.
Very good. Dr. Nahza, thank you so much. Dr. Bowe, thank you so much for your expertise. We appreciate that.
Thank you for having us.
Have a great day, everyone. You're listening to Ask the Expert, WCHS Charleston, ABC News coming up next, local news, and then Jeff Jenkins on 580 Live. Have a great day, everyone.
580 WCHS AM, 96.5 FM Charleston, and 104.5 FM Cross Lanes, FM Cross Lanes, FM Cross Lanes, FM